A woman in Seattle has recovered from COVID-19, is warning people not to panic, but to take the virus and precautions seriously. Elizabeth Schneider, who is 37, went to a private party and 3 days later started to feel unwell. Half a dozen other partygoers subsequently tested positive, although she says none appeared outwardly unwell at the time. Elizabeth told me it felt a bit like the flu.
I fell sick and started feeling just a general feeling of malaise and being unwell. I started getting body aches all over my body, just soreness all over my body. It was sort of similar to how you would feel if you had just gotten back from the gym and you'd done a really intense workout. I felt very fatigued, very tired. I felt feverish, and the first night that I fell sick, my fever spiked to 103 degrees Fahrenheit, which is 39.4 degrees Celsius. And then I did start feeling congestion in my sinuses and in my nose.
So, as things progressed, did your symptoms get worse? And if so, how so?
So I would say they didn't get too worse. I did continue to have a fever for several days. Fortunately, the next day after I spiked to the 39.4 degrees C fever, my temperature came down to 101 degrees Fahrenheit. I did have extreme fatigue for the next several days. I still had the body aches. I started getting more of the congestion. I was basically the only thing that I could do was really sleep in my bed. I couldn't cook. I ordered food for delivery. I basically only got up to go to the bathroom, take a shower, and eat, and then I just went straight back to bed. But interestingly, with my case, I didn't have any respiratory symptoms. I didn't have a cough. I didn't have any shortness of breath. I didn't have any tightness in my chest. And this, at the time, was being circulated as the main symptom for the coronavirus. And so when I first fell sick, I honestly thought I had the flu. I didn't even really think of the coronavirus.
So you were able to stay home the whole time? You didn't have to go into hospital?
Yes, that's correct. I stayed home the whole time and I didn't go to the doctor. So I was recovering okay on my own. I took over the counter medications. I stayed home from work. I got a lot of rest. I drank a lot of water. And as I mentioned, I didn't think that I had the coronavirus. I thought it was just a flu. And I've been to the doctor enough times where you have a virus, and the doctor basically says, I can't give you any antibiotics. You just need to go home and rest and recuperate. So I think I was fortunate and lucky. I'm 37 years old. I don't have any underlying health conditions. I'm relatively healthy. So, I had sort of mild to moderate symptoms. I think that this is quite a severe virus for people who are older or have underlying health conditions. And the other thing I want to mention is that not everyone, I think, is going to have the same symptoms. I think there's a lot more people out there that have this virus and they just don't believe that it's the coronavirus. They don't have, all of the telltale symptoms that are being circulated in the media.
But to be clear, you did have a COVID-19 test and it returned a positive result.
Yes, that's correct. So what I ended up doing is I found a couple days later after I fell sick that one of my friends who had been to a house party, 3 days prior to falling sick, had posted on Facebook that she was feeling unwell. She had very similar symptoms to me. And she was asking if anyone else was sick. Several people commented, and they were all at the same party with me. And all of us, about 12 to 15 in total, we all fell sick exactly 3 days after the party on the same day. Interestingly, these friends went to the doctor. Their doctors all thought that they had the flu. They were tested. They tested negative for the flu. They were never tested for the coronavirus because their symptoms didn't seem to indicate it was the coronavirus. A few days after that, we were all talking amongst ourselves on Facebook and kind of getting frustrated that, these people that went to the doctor weren't tested for the coronavirus. So that's when we came upon a research study that was happening in Seattle. It's called the Seattle Flu Study. They were originally only testing for strains of the flu, but because of the outbreak in Seattle, they decided to take it upon themselves and test for coronavirus. So we all signed up as volunteers, and they sent us at-home nasal swab test kits. And that's ultimately how I found out I was positive. I got a call on a Saturday, March 7th, and in total, there are 7 other people from the party, including myself, who have all tested positive for COVID-19.
How many days after you got these symptoms did you start to feel well again?
It was about 8 days, so it was a full week or more. And my fever came down. It came down under 100 degrees Fahrenheit. My body aches went away, and some of the fatigue gradually started going away. And there was one evening I distinctly remember I was watching television and eating dinner, and all of a sudden I just felt like that fog that was sort of clouding my brain and making me feel tired and unwell just gradually started to lift. And I got my energy back, and I suddenly felt normal.
So, Elizabeth, what would you say to those people who are not taking this particularly seriously? They're not heeding the messages about isolating themselves. They're not listening to the messages about staying away and keeping their distance from people. What would you say to those folk?
I would say that this is a definite serious situation. And I can tell you from my experience at this party, it was only about a group of 30 to 40 people. No one was visibly sick. No one was coughing. No one was sneezing. No one looked like they had a fever or said they were unwell. It was a typical party. The only sort of, touching that we did was, hugging to say hello, and greeting people. And, like I said, about 12 to 15 of us got sick. And so this virus transmits very, very easily. And myself and all my friends were very lucky in the sense that we ranged in age from my age 37 to early 60s, and we experienced mild to moderate symptoms. But I think that if you're older or if you have underlying health conditions, this could be potentially serious. And I've also heard that there are multiple strains of the virus that are circulating. And to give you some context, I have spoken to many reporters all over the world. And I just spoke last week to a reporter from USA Today. She's interviewing people who have the virus about their symptoms. She messaged me and said she was going to interview a man in his 50s who had the virus, but she had to cancel the interview because this person died. And, if you consider myself being 37, someone in their 50s is not much older than myself, and this person had 2 young kids. So this disease that's caused by the virus is very serious. And, we need to do what we can to prevent the spread. Everyone talks about flattening the curve. By staying home, by isolating ourselves, by not going out to bars and restaurants or going out to public gatherings, we're going to try and limit the spread of the virus so that we don't overwhelm our hospitals and so that we protect people in our community that are most vulnerable.
And that is Seattle woman Elizabeth Schneider, who has recovered from COVID-19.